We wanted to see if we could improve the response monitoring of metastatic breast cancer to the bones. Our experiment consists of doing a whole body MRI scan with diffusion weighted sequences. Take a look at this woman with diffuse metastatic breast cancer in whom the T1 weighted images seem stable, but where we can see changes occurring on the diffusion weighted sequences. Let's see how we can analyze the fourth examination. Once the data is acquired, we load it into some specialist software. We then segment the data by applying a threshold to the signal intensities. We cut out areas of normal tissues to leave us a final mask of where the disease is. We then use this final mask and we color code it according to ADC classes. ADC, the apparent diffusion coefficient, represents the amount that water moves in tissues in 1 second, measured in micrometers squared per second. These ADC classes are chosen to show the relative cellular states of the underlying tissues. So the red class is meant to show cellular areas. The yellow class is meant to show microscopic death, and the green class is meant to represent macroscopic necrosis. Therefore, in a response assessment setting, voxels that are red are deemed not to be responding. Voxels in yellow show likely response, and green voxels represent areas that are highly likely to be responding. Of course, it's also possible to measure the relative proportions of these different classes of tissues using histogram statistics. Let me show you an example of a 56-year-old woman who was initially treated for breast cancer in 2006. We see her in 2012, and over the next 4 years she receives 5 lines of anti-cancer therapy. We pick her up in May 2012. At this point we can see that she has highly cellular tissue, and the red voxels make up about 95% of the total segmented volume. We also give her 1 fraction of radiotherapy to the right hip. We initially treat her with exemestane and Herceptin therapy, and we see her some months later, and you can see that there has been a very modest response to treatment. There are only small scattered areas of yellow and green. This is not a clear response to treatment. In the meantime, she has also developed metastatic liver disease. So we switched her to pertuzumab, Herceptin, and a taxane. And what we observe is a great response to treatment. About 50% of the tumor shows some response. On her next scan, we can see she's beginning to relapse. The relapse appears to be occurring in the region of the right hip. You'll remember that this is where we first gave her radiotherapy. On her next scan, we begin to see more red throughout the skeleton. Finally, we can see that she's back to her pre-treatment state with 93% of segmented voxels in the red region, and her liver disease has returned. We then switch her to a chemotherapy with lapatinib. Again we see a fabulous response. It looks as though the degree of response is greater than with the pertuzumab treatment. This time 25% of the voxels are considered in the active range. We confirm this response on the next scan. Again, she shows green voxels only. On the next scan, we are beginning to see some areas of red. However, 75% of the voxels still show a good response to treatment. On the next scan, however, we see things beginning to slip. There are more areas of red emerging, indicating that she is likely to relapse shortly. By August 2014, we can see that she's now in full-blown relapse. Time to switch the therapy. So we switch her treatment to TDM1. This time we see a differential response with a greater response in the region of the previous radiotherapy. The rest of the skeleton does not appear to have responded that well. Unfortunately, the effective treatment does not last long, and she begins to relapse, and we confirm relapse on the next occasion. So we switch her to vinorelbine chemotherapy, and we see no further response. She continues to be on chemotherapy, currently on epirubicin and denosumab. In 2017, she has developed increasing volumes of metastatic liver disease. So what have we learned? We've learned that the effectiveness of the therapy can be mapped using water diffusion in tissues. Quantitative whole body MRI enables the extent of response to be quantified and treatment failure to be more accurately documented. We learned that spatial heterogeneity of response occurs, probably related to the clonal evolution of tumors, modulated by microenvironmental factors. You'll remember the differential responses occurring in the region of the right hip, which had originally been irradiated. This ability to visualize spatially heterogeneous responses enables us to know where to sample tissues in order to determine the mechanisms of discordant behavior.